Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So as of today, we have a total of 1,750 cases. This is an increase of 190 cases since I last reported on November the 10th. And the week before, I had 110 new cases. So that is a very large increase, very large jump. For the week of November the 1st to November the 8th, we had a total of 141 cases, and that's the highest increase that we've had in any single week. The number of cases that we've had since Friday was 116, so 85 over the weekend, and then 31 yesterday. If we look at the last day, the 31 cases, 30 of them are sporadic, and one of them is in an institutional setting, an educational setting. 17 are males, 14 are females. Their ages range from under 10 to in their 60s. 29 of them reside in Simcoe County and 2 in Muskoka. 1 is a community-acquired case, 7 are from close contacts, 22 are under investigation, 1 is in an educational setting outbreak. And all of them are on self-isolation at home. We have a total of 217 active cases at this time, which is up from a week ago at 143. And we have 1,360 cases that are recovered. At this point in time, we have 7 individuals that are in hospital, which is down from 8 last week. And those individuals range from in their 40s to their 80s. 7 in Simcoe County and 1 in Muskoka. 1 of them is at RVH, 2 are at Southlake, 2 are at Georgian Bay General Hospital, 1 is at the Muskoka Algonquin Healthcare Center, and 1 is at Mackenzie Health in Richmond Hill. The number of deaths that we've had remains unchanged at 50. We currently have 12 outbreaks happening, which is the same number as we had when I last reported. So 6 are in institutions, with a new one in the past week, Holland Gardens Retirement Residence in Bradford, West Gwillimbury. We have 1 group home in outbreak, which is unchanged. We have 3 workplaces, which is up from 2 last week, and 2 educational settings, which is down from 3 last week. And we no longer have any outbreaks happening in community settings, which is down from 1 last week. So I'll be getting into the details of the locations, details on those locations a little bit later. We continue to see clusters of cases occurring in households, and more recently they've been households of family members, or for that matter clusterings between households but of family members. So some instances of family gatherings beyond a household that are leading to transmission. And in the month of November, we've had a total of 19 household clusters throughout Simcoe County and in Barrie. The size of these clusters ranges from 2 to 11, so up to 11 people has cases associated with these clusters, each one of these. The average size being 5. We have a concentration of our cases in southern Simcoe, the new cases. So that would be in keeping with the pattern we've seen all the way along through the pandemic. So that would be in New Tecumseth, Innisfil, Bradford, West Gwillimbury, and in Barrie. And much of this is related to people commuting to the GTA for work, being part of outbreak transmission in their work, out of the GTA to out of Simcoe, Muskoka in the GTA, and then leading to transmission in the home environment. We also have connections between household outbreaks and school exposures or school outbreaks, and in one instance with a food premise, and I'll be speaking to that later. The issues that we see for these transmissions, apart from the workplace issues that I've described before, and the importance of workplaces exercising the full range of protective practices with personal protective equipment, face coverings, hand sanitization, screening of employees before they come to work, and maintaining those practices not just during work but also in the lunchroom and with regard to socializing of workers, is that we're also seeing transmission in the family setting, as I've described. So here we're getting people coming together and not physically distancing with people beyond their household, or not using face coverings. And at this point, for quite a while now, I've been saying that we really need to stick to our household for close contact and not have direct physical contact or be within 2 meters of other people. Even if they're from your family, you need to be physically distancing. With regards to schools, since school openings in September, we've investigated 81 sporadic cases involving 47 schools, both elementary and secondary. And at this point in time, we have 2 school outbreaks. So the great majority of those exposures did not lead to transmission, and that, I think, is a testament to the safety of the school environment, the precautions in place with school environments. It does speak to the importance of people screening their children before they go to work and before the children go to school, and excluding them from going to school if they have symptoms. Really important. So we right now have 2 school outbreaks, one at the Nottawasaga Pine Secondary School and the other one at Our Lady of Grace Catholic School, both in Angus. And I'll be providing more detail about that in a moment. With regards to our health unit dashboard, and this isn't to be confused with the province's framework, both are going to continue to exist. So at this point I'm talking about what's on our website. We remain in yellow status, and this is because we continue to have a red alert for viral spread and containment. So this is because we're having an ever-increasing weekly case count. We also have a high reproductive number of 1.2. So anything that's above 1 means that the pandemic is growing here. We continue with a high number of outbreaks as well. We also have a red alert with regards to laboratory testing. This is because we continue to have a less than ideal turnaround time for our laboratory testing. So only 68% of our tests come back within 2 days. We would like a quicker turnaround time than that. By the way, our percent positivity here is 1.9. Certainly anything above 3 is very worrying, and 1.9 is an increase from the past for us. It's still quite a bit less than the provincial figure at this time. Health system capacity is in yellow, and this is because there's a high occupancy for acute care beds. Not due to COVID-19, just because of healthcare provision. We've actually had a reduction in the ICU bed occupancy below the limit, that our goal that we have in our framework of 90%. And the ICU ventilation beds is also low. below 60%, so it's 26.9. And with regards to our health system capacity, we have ourselves in yellow alert because we still remain challenged in our ability to follow case and contacts. We wish to reach all of them within 24 hours, or at least a minimum of 90%. And we remain at 84.1% for the contacts and 86% for our cases, which is about what it was in the past week. In terms of the trajectory of the pandemic, the weekly incidence of cases right now is 30.1 cases per 100,000 population per week, which is up substantially from last week at 18.8. It's still considerably less than the provincial rate this week of 69 per 100,000 per week. And that too, the provincial rate has also gone up from the past week. We have a doubling time right now of 44.8 days, which has decreased from a week ago when it was 70.9. So basically you want a long doubling time. The longer the doubling time, the better. If it gets shorter, that means that things are happening more rapidly or cases are growing more rapidly. One thing I would point out is that with these indicators, right now we're officially deemed to be in the yellow status, the protect status in the province's framework for control measures. And I would say this is a designation the province establishes, and they take into account the kind of indicators that I've already spoken to. But I would also point out that if we continue now with a higher incidence of cases, and we continue with a higher percent positivity, we would meet the criteria for the orange restrict status. So I think that that's an important heads up for people about the potential for us to be moving into orange at some point in the future if we continue with that level of activity. But for now, we're in yellow with regards to requirements. So just moving on to our outbreaks. Simcoe Manor continues in outbreak status, but unchanged. We don't have any new cases among the staff or the residents. So 33 staff has cases, 43 residents has cases, 10 deaths, no additional deaths in the past week. And testing results have otherwise been negative for the remainder of the staff of the residents. We continue with our control measures, and we are hopeful that things will persist in this way and that we will then surpass the duration required before we can declare this outbreak over. But for now, it's still an outbreak. Waterford Retirement Residence in Barrie was declared as an outbreak on November the 2nd. It remains unchanged with a single positive resident case. Testing of staff and other residents have come back as negative. IOOF, seniors residence in Barrie, declared as an outbreak on November the 4th. Only one positive staff case, no resident cases, and test results have come back and been negative for staff and residents. Allendale Station Retirement Home in Barrie declared as an outbreak on November the 5th, with 3 resident cases. We now have 3 staff cases. That's up by 1. There were 2 cases last week. The other staff and residents have come back with negative results. Simcoe Manor long-term care facility in Collingwood was declared as an outbreak on November the 8th, and they have 1 staff member who's a case, which we had last week, but we also have a resident case as well, so that's new, an additional case. Otherwise, testing results on the staff and the residents have come back as negative. Holland Gardens Retirement Residence in Bradford, West Gwillimbury was declared as an outbreak on November the 13th, so that's a new outbreak. We have one staff case and no resident cases to date. Tests have been drawn for the residents and the staff with results pending. With regards to our schools, we have two schools that are in outbreak, both of them in Angus, one at Our Lady of Grace Catholic School and Elementary School. It was declared on November the 12th with two staff and one student. Another outbreak is a secondary school, the Nottawasaga Pines Secondary School in Angus, declared on November the 15th. So that's a new outbreak as well since I last reported. We have 5 students that are positive, and 100 high-risk contacts are presently in isolation. With regards to congregate settings, we have one group home that remains in isolation. It was declared on November the 6th with a single staff case, unchanged from when I last reported. We have no community setting outbreaks. We have 3 workplace outbreaks, up from 2 a week ago. One in Barrie, a manufacturing facility, declared on October the 31st with 13 staff cases, which is unchanged from when I last reported. And another manufacturing facility in Simcoe County, it was declared on November the 12th, so that's a new outbreak since I last reported, with 2 staff as cases. And we have a restaurant in Angus, which was declared on November the 12th, with a total of 5 staff as part of that outbreak, and no exposures to the public. We are aware that, according to media reporting, this restaurant had made a declaration publicly about their status, being the McDonald's, or a McDonald's in Angus, and so I'm confirming that. We set up a testing at the secondary school in order to facilitate testing in Angus. So I know that there was one question from the media about that I will get to later in my report. With regards to my media notes, one thing I would note is, as I'd indicated, we are in the level of yellow protect with regards to the province's framework. And last week I had there were questions from the media about what that means in terms of restrictions. I indicated that we needed to look at the regulations in order to be certain about what it meant. So I can clarify a few things today. First off, we continue to allow sporting leagues to remain open with a maximum of 50 individuals in any one league. So we call that a cohort. They have to remain within that group. They can't have others become part of the league in order to contain any outbreak or spread that might occur. And they need to be physically distancing in their sport. They need to, if it's a contact sport, alter the game so that there isn't intentional contact with the sport. The spectators are limited to no more than 50 indoors and 100 outdoors. The league itself, I should say, I mentioned 50, that's for indoors. It can have as many as 100 outdoors. With regards to fitness classes, this is restricted it's restricted to 10 people for indoors, and they have to be apart by 3 meters, so that's up from the usual 2 meters, and this is in order to address outbreaks that have happened in indoor classes with intense physical activity. Also, the facilities have to have a safety plan, and there's a limit for multiple facilities in any one unit. So you can have multiple facilities such as pools, arenas, and rec facilities. Each would be capped within the requirement of 50 individuals. The other thing I would say is I'd indicated that restaurants are limited to no more than 6 people per table. And there needs to be continued monitoring of the attendants taking a name so that follow-up can be done if there's any transmission under investigation that might involve those who had attended the restaurant. One thing I would say is people need to be mindful of the potential for change as well. I'd already indicated that with our data, if it continues going up, we may very well find ourselves at some point in the orange status. For now, we are in the yellow status. We have a resource on our website, attestation forms to help people return to school, childcare, and sport teams if they've had a case of COVID-19, been a case of COVID-19, or have been in isolation as a contact. So these attestation forms are to help you provide documentation back to those settings in order to provide them with the information, the documentation that they would require of you. So that's there as a resource. A word of caution about upcoming celebrations with holidays through the winter. As I've noted with our experience with Thanksgiving, there is definitely the potential for transmission with family gatherings. We had a 15% increase in the number of cases associated with Thanksgiving, the 2 weeks that followed Thanksgiving. We could trace right back to gatherings. So transmission does happen in those settings if you're not careful. I've been saying that you really need to stick to your household for direct contact and otherwise be physically distanced from each other. So this certainly goes for family gatherings as well, and we've got some messaging about that topic on our website with some details. One of the other key things about holidays and such would be students attending college or university and coming back home. A key message that we're putting to youth right now is to do what you can to avoid becoming a case and then transmitting back to your home. So people attending these institutions away from home, you need to be careful about contact and physical distancing and hand hygiene, face coverings, so as not to become a case, and you certainly don't want to be bringing it back home and affecting your loved ones at home. We also have content on our website about office parties. So that's a big part of the holiday season, and they too can be dangerous with regards to transmission at this time. This is just not a normal time for us, and so things won't be as they usually have been in the past. And we'd be asking employers to be very careful about parties, to reconsider whether or not you need to have them. So you need to be taking precautions. You need to be aware of the requirements. You still need physical distancing and face coverings, and caution with regards to the provision of food. So the most cautious way of all would be remote or not having it at all. Like I said, we have some detailed information on our site about the holidays in general, about what you can be doing more safely with your family, what you could be doing more safely with regards to faith observances as well. So we have a question here from the media, which is, When driving past the Nottawasaga Pines Secondary School on Thursday, I saw what looked like a testing site set up in the parking lot. Did the health unit set up a pop-up testing site? Was it only for students? How were they informed? Does the health unit do pop-up testing at high-risk locations? So indeed, we did help to organize testing at Our Lady of Grace Secondary School. Actually, I beg your pardon, we set up the testing at the Nottawasaga Pines Secondary School because of the outbreaks that had been happening with the two schools. So this is something that we have facilitated, and it is something that we make available for those affected in that. So that would be students that we identify as being at risk. And if there are any teachers that we identify as being at risk, it facilitates them being tested while they otherwise go into self-isolation. And indeed, we've been working to set up pop-up assessment centers when needed. Whenever we have an outbreak, we're looking at what is needed to facilitate testing for contacts. And we work with assessment centers, notifying them and use that channel if we can to have it happen, or otherwise work with partners to have an on-site testing facilitation happen to have it go smoothly when required. So at this point, I'd be happy to take questions or comments.
Thank you, Dr. Gardner. Mandy Webster from Rogers, do you have a question?
I do. Hi, Dr. Gardner.
Hello.
We talked a lot about us currently being in the yellow zone and the high potential of going into the orange. What or how would orange affect our area when it comes to recreation, dining in? What effects would that have if we went into orange?
It's not greatly different. One of the differences is that the table size would be restricted further to 4 instead of 6 in restaurants. Another would be that recreational facilities that would be allowed now to have 80 participants per venue within the facility would be 50, I should say, no more than 50 per venue per location within their facility would be restricted to a total of 50 for the entire facility. There's some restriction on the hours of sale of alcohol, and that would be further restricted with regards to going into the orange level. We would have to, I think, have another look again in detail to make sure that I'm not missing anything on that. But when I look at the regulation, my own take is that it's fairly limited in its impact.
Awesome. Thank you so much. And just a short follow-up. It's not, I just want to clarify that it's not quite as drastic as if we were to go straight for red.
No, it's not as drastic as going for red.
Great. Thank you.
You're welcome.
Thank you, Mandy. Erica Engel from Barrie today. Do you have a question?
Hi, yes, I do. I've been speaking with the municipal staff in charge of our rec facilities here, and I just wanted to confirm with you that the advice they're getting from the health unit is if a group is, say, renting the arena or the pool, and they have a governing body like Ontario Hockey Association, Skate Ontario, or the competitive swimming organization, then they can sort of stick to that regular limit of like 25 people on the ice. But if they're just renting the ice for, say, like an adult hockey team, they can only have 10 people on the ice. Does that track with what you've been recommending to municipalities for the yellow zone?
It is what that would be consistent with my understanding. But I think with a detail like that, I'd rather check with my enforcement staff and get back to you.
Okay.
Okay.
And the provincial framework also notes these are the criteria for region entering the orange zone, and that a decision would sort of be from the province, but taking into account local public health authorities input as well.
Yeah.
If next week looks like this week, would you be suggesting that we should maybe enter the orange level?
I believe we need to take steps to protect our population from COVID-19. This framework is meant to achieve that, and we need to work through those levels and abide by them. If we're meeting the criteria for going up to another level, we need to do that.
Thank you.
You're welcome.
Thank you, Erica. Ian McLennan from Barrie 360, do you have questions?
Yeah, hi, Dr. Gardner. You talked just a moment ago about, inching toward that orange color zone, so to speak. But Dr. Williams the other day, or just less than 24 hours ago, suggested the province could be in the least restrictive green zone by Christmas. Is that reality, or is he missing the mark here? Just your take on that?
I doubt that very much, based on the projections that have been released, where we could very well end up with much higher rates of transmission into December. The alarming projections were as high as 6,500 cases per day, which is more than a fourfold increase over what we're experiencing right now. I think it would take a great deal to flatten the curve, and it would take longer than from now till Christmas to flatten and start to see it coming down, let alone getting into the green. So personally, I don't think so.
And one final question, Dr. Gardner. Toronto's Board of Health voted to ask the Ford government to make advice from the groups advising Dr. David Williams and the Premier public, and indicated they had to sign non-disclosure agreements to participate in discussions held by the health measures table. I'm just curious if you would like that advice made public, and if Simcoe, Muskoka Public Health or staff have had to sign any non-disclosure agreements.
So I am on the public health measures table, and I had to sign a non-disclosure agreement. It's actually standard practice for any committee that I've ever been on with the provincial government. So that's been the experience that I've had the entirety of my career. So in that regard, it's not unusual. I see very good information brought to that table. There are background reviews of the scientific literature on like evidence basically about public health measures and the degree to which they can help, and situational reviews about the control measures that have been put in place in other jurisdictions. In my opinion, making that a kind of information available would be helpful to clarify why we need these measures, and I think help people understand the need for these measures and allow people to see the evidence for themselves. The original research is available to all. It's just been put together as a single reviews to make it easier to view. So in my opinion, it would be helpful to make that kind of information available.
Thank you very much, Doctor.
You're welcome.
Thank you, Ian. Sarah Law from Muskoka Region, go ahead, please.
Good afternoon, Dr. Gardner. On November 13th, a release went out saying that a staff member from the Pine Swamp turned positive for COVID, but I saw that it is not considered an outbreak status. So I just wondered if we could get a little bit more information about that.
I'm afraid that would be news to me, and I would need to look into that. I'll report back to you. I'll let you know. Okay.
Thank you. And my follow-up question is that yesterday the province said that health units could react faster than the province to protect long-term care residents. And I was wondering what you think of that statement, or if it concerns you.
Well, first thing I would say that I actually issued an order some weeks ago restricting visitation to our long-term care facilities to what we call essential visitors. So any resident could have up to 2 family members designated as essential visitors. and they would otherwise have to be abiding by the infection control practices in place and the facilities to further prevent spread, to protect the residents. And I also prohibited residents from doing away visits. That was because we were seeing increasing transmission, and we were seeing some long-term care facilities in outbreak, and I'm very concerned about the potential for large outbreaks with mortality, and felt it was necessary to put that kind of protection in place. So that is something that medical officers of health can do. Certainly the province can do that, and they put in place that kind of restriction in Toronto and Peel and Ottawa. I'm not sure if they've extended it at this point to other health units that are considered in the red zone. But it is something that the province can do. It's something that MOHs can do. I think although we might be able to do it more quickly, the province can do it in a much more uniform way and therefore ensure broader protection, not just one health unit at a time, but they can apply it geographically broadly, and in that regard they can be more effective.
Thank you.
You're welcome.
Thank you, Sarah. Chris Simon from the Barrie Vance, go ahead, please.
Yes, thank you. Hi, Dr. Gardner.
Hello.
Just wondering if there is a point in which you would consider implementing tougher restrictions the province has in its color coding system.
Indeed, we are looking at that. Considering that we're seeing now a fairly rapid rise again in our cases, and considering that some of my colleagues have done this, those that have been in the leaders of much more heavily hit parts of the province, Peel and Toronto in particular, have issued orders or letters of instruction requiring more protection. In the case of Toronto, disallowing indoor dining in bars and restaurants, and restrictions on use of fitness centers and convention halls and such. Peel, other restrictions, not exactly those, but other restrictions. So we are looking at the potential for that now, and deciding what it is we would do based on the pattern of transmission that we see here, and looking at when that kind of thing would be warranted. So it's definitely under development. Not proceeding with anything like that yet, but it's under development.
So we're now seeing case counts that, in some cases, daily case counts that are exceeding weekly case counts at the height of the first wave. So how bad would it have to get for you to take some of this direct action, and how much notice would the public get?
I wouldn't want to wait too late. The problem with leaving things too long is it becomes much harder to bring it under control. So that would be one reflection I would put forward. I don't have a definitive number in mind, but just as a concept, I would put it that way. And I haven't decided about timing or how, what the warning would be either. So I wouldn't really be able to give an answer to that question.
Okay. And sorry, just one point of clarity. You had mentioned the Waterford was in Barrie was still under outbreak, but it's actually listed as being over on the Health Unit website. Can you just provide some clarity about its current status?
I'm just having a look here through my list. Declared on November the 2nd. Still have it on my list, I'm afraid. But if in fact that happened in the interim since I've met with my staff this morning, then I would have to update myself. So I will look into that and I'll get back to you.
Thank you.
Okay.
Thank you,
Gardner and Kathy. Thank you.
Okay.
You're welcome. James Bowler, are you on the line? Okay. Mike Arcelides, would you like to go ahead?
Say Mike Carson.
Yeah, Mike, go ahead.
Yeah, sorry, I just got to jump out of my car here so you don't have a reverberation. Doctor, good afternoon. What is your advice right now to folks as we notice these clusters in these households? Things continue now for the last month and a half. Do we need to really batten down the hatches here and get a little militant to hammer home the point?
I think it's really important that people take to heart the advice that I give. So, do what you can to reduce your risk. Some of that transmission is due to family gatherings beyond a single household. So the larger family gatherings either shouldn't happen at all or needs to be done with extreme caution with people physically distancing. The other cautionary note would be at work. Individuals can introduce it into their home from work. So they need to exercise all the precautions that should be in place at work: physical distancing, mask use, hand hygiene, self-screening, not going to work if you're ill, caution if you are actually with regards to travel to work. So carpooling is probably not a good idea at this time. Normally I'm a big fan of it, but not during the pandemic. And if you are carpooling, one person driving, the other person in the back seat with a mask, both masked, and having the window open. So those kind of things need to be done. I mentioned the caution about students coming home. If they're not careful, they can bring COVID home from their time at college or university. They need to be mindful of that and exercise all of those precautions in their social lives. So it's really about keeping it out of the home. Once it's in the home, it can be very difficult to prevent it from spreading. If you're in a situation where it's in the home, then you need to be exercising all the isolation precautions that we as the health unit will follow up with you about. But we can end up with really high, what we call attack rates in the home, a high percentage of the people in the household infected because they're in intimate contact with each other.
So in your, sorry to interrupt, so in your professional medical opinion here, is that the driving force behind this resurgence and the escalation of infection rates in the community? Is it workplace and a lack of physical distancing once people punch out, so to speak, and go home and hang out with their buddies and have a beer and not wear a mask?
Well, at home, we're not telling people at their home that they need to physically distance. That would only be required if you're in an outbreak setting in your home. If you have a case in your home, then you've got to be isolating cases from contacts. But the precaution needs to be before you get home, while you're at work, while you're at university or college. Certainly caution with regards to socializing outside of your home. You need to do all that you can to prevent becoming a case and therefore bringing it into your home. And we're in a position where we can enforce with regards to the work environment. And the province has placed restrictions on social gatherings, indoor and out, in terms of numbers. So that's something that is enforceable, though difficult to enforce. It's hard for public health and police and bylaw officers to be everywhere at once monitoring those kinds of gatherings. So in theory, there's the ability to enforce. In practice, I think it's quite difficult. And I go right back to people need to be aware of what it takes to be part of the solution and not become part of the pandemic, part of the outbreak.
So would you say that the issue is, folks, that fatigue has reached a point where people are just saying, screw it, let's wait 3 weeks until they figure out the vaccine?
I do believe that there is a lot of fatigue. I do believe that it's increasingly difficult for people to abide by these restrictions in their lives. We see the evidence of it when we see clusters associated with gatherings, or people at work becoming cases because they kept up the precautions all through their work, but then they had lunch together without the precautions, or they went and socialized together without the precautions. So we are seeing evidence of fatigue, and it's hard to overcome. If we are to bring this under control, it's going to have to be people finding a way to overcome their fatigue, and also the control measures that we put in place. But those control measures are really meant to help people, remind people, give them supports to abide by these practices in their lives.
Thank you. You're excellent.
Thank you.
Okay, thank you, Mike. Yeah, is there anybody from the media who was on the line who has not had an opportunity to question Dr. Gardner?
Yes, please. John McFadden, Indigenous Issues Reporter, MuskokaRegion.com, Simcoe.com.
Welcome, John. Go ahead.
Thank you very much, and thanks for taking my question, Doctor. I don't mind telling you that I'm on day 2 of week 4 in this new role, and so if I say something that makes it sound like I'm new to the job, that would be why. Doctor, I've researched the First Nations territories in Muskoka and Simcoe, and it sounds like, for the most part, they've done a very good job at keeping COVID off their territories, perhaps even a better job than non-Indigenous people have. And I'm just wondering if you have any thoughts on why that is.
I am happy with their success, and they have put in place measures to enable people to be tested and raising awareness around the control measures in their respective communities. And we're happy to help where we can, where they would want us to help. But certainly we've extended out an offer of assistance and seeking to be connected with our Indigenous communities to help where they feel we could be of assistance. But I'm happy with their success to date.
Very good. One follow-up, if I may. We know that the territories themselves tend to be isolated, and that maybe has helped in terms of keeping COVID at bay from the territories. But on the territory itself, we know that Indigenous people tend to gather with family in particular, more so than non-Indigenous people. Family very important to them. Do you have any thoughts, suggestions, thoughts about how they've been able to, as I say, keep COVID at bay to some degree? Any thoughts on what they might be doing on the community itself, and with this cultural aspect, if you will, where family tends to be more important to Indigenous people? Any thoughts or advice about what I've just sort of laid out there?
I am aware in at least 2 of our Indigenous communities that there's been strong messaging from their health services about the controls that are needed. I would make the same recommendations to our Indigenous communities as I do otherwise, which is that people need to be aware of how this is transmitted. Ideally, you're sticking to your household for intimate contact, and that you're otherwise maintaining 2 meters distance from other people, even if they are family. If they're not in the household, you need to be maintaining that distance. Outdoors is a safer place to meet than in, people really should be using face coverings if they're in an indoor public setting or if they can't physically distance. Hand hygiene is always really critical. Self-monitoring for symptoms, and if you have any symptoms, isolate and seek testing is really critical for everybody, including in Indigenous communities. And I know that all of these things are tough. It's only natural for us to want to get together with extended family and friends and embrace and be close. And unfortunately, that carries with it now a risk. And as this disease becomes more prevalent, the risk goes up. And so we have to overcome our natural tendency to want to be close in that way at this time. It's tough. It feels unnatural, but at this time it's needed.
And I know I'm the last person on the list, so cases, but do you have numbers for the other First Nations territories in Muskoka, Simcoe?
So we regard.
In terms of.
Yeah, we regard.
I'm sorry. Go ahead.
I'm sorry. Maybe I'll just pause for a moment, let you finish your question.
I was finished, but I interrupted you. My apologies.
No problem. So we regard their cases as for them as a community to determine if they want them reported publicly, if they would want us to play a role in that. We're aware of the cases you cited at Rama, and I'm not aware of any other cases in the other communities. We have a total of 4 First Nations communities in Simcoe, Muskoka, and I'm not aware of other cases in the other communities.
Thank you very much, Doctor.
You're welcome.
Okay, thank you. Just a reminder to anyone who might be on the line who haven't identified, you can always shoot me an email, and that way if we have any follow-up information we need to send out, we can do that. And if there are no other people on the line with questions, we will bid you a good afternoon and see you next week.
Goodbye, everybody.
Thank you.